I am one of the leads on the Biofilms theme. Biofilms themselves are groups and communities of bacteria that attach to an interface, mainly a surface, and they can be found in all sorts of different environments. And a lot of work has been done previously on environmental biofilms, but within this theme we're mainly interested in the impact of biofilms in clinical environments and in human health. And this is particularly important when we look at things like chronic recurring illnesses and diseases and the prevalence of antimicrobial resistant bacteria within hospital and clinical environments, and what we can do to prevent their spread and persistence. There are several aspects of my own research which are quite unique in the approach we're taking through the Institute for Life Sciences. My own background is in environmental microbiology and environmental biofilms, and what this research is allowing us to do is to take techniques that we've developed for environmental systems and apply them to clinical settings and problems. And in particular, in my own work, this is looking at the contamination of urinary catheters and biofilms on urinary catheters. And through the Institute, we're able to collaborate with colleagues from engineering and materials science, right the way through to health sciences and medicine, so that we can take the research from the laboratory bench to the patient. As I just mentioned, we're taking an interdisciplinary approach to the problem of contamination of urinary catheters and the issues caused by biofilms. And this is really important because it's allowing us to develop techniques which are actually useful in healthcare. Quite often we can solve problems in the laboratory, but when it comes to translating them to a real world situation, they just don't work so well. So it's really important that we pull in all the experts from all the different fields so that we can really tackle this problem effectively. This theme has the potential to have high impact for both patient care and the NHS financially. Specifically within my own work looking at contamination of urinary catheters, if we were able to understand biofilm development and this lead to the development of new materials which can be used for catheters, we could be having a great impact on the quality of life for a lot of catheter users, and also saving the NHS a lot financially and in terms of healthcare burden. So this work and the other projects being carried out under this theme are all about how we can use our understanding of biofilms to improve healthcare for many different conditions and environments. So we have other projects looking at things like producing anti-biofilm materials for environments such as surfaces, looking at the improvement of vaccine development and design, the delivery of drugs, and this all feeds into antimicrobial resistance work as well, and coming up with strategies which could help prevent the spread of antimicrobial resistant bacteria in clinical environments, which in turn will lead, hopefully, to improvements in how we treat things like chronic infections and illnesses.